Welcome to part two of this wonderful dialogue that we are having with Dr. Bhuvaneswaran, cardiologist, director of the PSG Speciality Hospital. In part one, we got a glimpse into Dr. Bhuvaneswaran's early childhood, the trials, the tribulations, the challenges, and more importantly, the beautiful things of what he learned, whom he learned from, and some exceptional anecdotes in terms of how we can be a good human being and a good friend. So, in part two, what we're going to be doing is we're going to be talking to the cardiologist and the team, the young team that is helping with the production, the shooting, and all of that. In the break, one of the youngsters was very keen to know that today we have a lot of incidents, a lot of people saying that they are having heart attacks or cardiac conditions at a very young age. So this section we are going to be speaking on physiological health, primarily cardiac health, which I think is a matter of interest to everybody, because the day the heart stops pumping is the day that the physical body is dead, right? So we're going to be, I'm going to be asking some layman questions, and hopefully Doc will not get very irritated with my questions. I'm sure he's got more people asking him all kinds of questions in the course of his life as a cardiologist. So, Doc, first question. Well, I'll start with what Arun wanted me to ask you, which is today we have a lot of incidents of youngsters. People are very, very young. Recently, there was a case that came up that a very qualified young person um, collapsed at the age of 27 or 28 and passed away. There's been a whole lot of things that are going on. I also read somewhere that technically the human body can live up to 120 years.
Yes.
And if it dies before then, it is because we have not lived or taken care of our body the right way. So, starting with just this cardiac situation, what is the reason that the incidence of younger people having heart attacks, cardiovascular conditions, according to you and your research and your knowledge, what are the reasons, and how, more importantly, what should we do to ensure that we can live a proper healthy life?
So, whatever I have learned in my 3 years of cardiology, you have asked me in a single question. Now, I want to actually start with some basic things which I feel many do not give importance, but although it's very important for you to understand the cardiac issues and to avoid or to prevent the consequences. See, basically, most of the diseases, what we call it as diseases like heart-related diseases, they are all multifactorial. When I say multifactorial, first I have to start with the triage. See, you have, all of us know that there is a soil, a seed, and the atmosphere concept. So, soil is the what you are, who you are. The seed is the disease, and whether the seed becomes a strong tree or a plant depends on the soil as well as the atmosphere, which should give its water and sunlight. So, in a multifactorial concept, if somebody has to have a heart disease, his soil, his body, his genes, genetic makeup is weak, and the seed or the risk factor which causing the heart a problem is very strong, and which is added by the other acting co-risk factors. This is how disease happens. Scenario 1, a young man who has no family history of heart problem, a regular exerciser, everything is fine, and he goes playing football and he dies suddenly. It's blamed as heart attack. Now, unfortunately, in many of such situations, the postmortems are not done in this country. But as a cardiologist, I know that this man might not have died by a so-called classical heart attack, but by some congenital heart defect which he has. If you do a postmortem, you will realize that his coronary artery by birth has a defect. This is one scenario. But it is labeled a young person having a heart attack. Correct. Scenario number 2. Somebody who is born 45 years, very strong family history of coronary artery disease or heart attacks in the family. When I say a family history is strong, at least 1 or 2 members in the family, men dying, having a heart issue less than 50 years, a lady dying or having a heart issue less than 55 years is called as family history strong. And this person has a cholesterol level of 300 plus, and he has diabetes, and he's a heavy smoker, doesn't do exercise, and this fellow, when he rushes to catch a train, he gets a chest discomfort, he gets a sudden cardiac death and dies. In him, you no need to even do a postmortem. I can tell clearly that his genes are weak because there is a strong family history, multiple risk factors, and he stresses, strains. So that is a classical heart attack. So this is what first we should understand. All people who get sudden death are not necessarily, it is a cardiac heart attack deaths. That should be very clear first. Number 2, generally it is a very, very clearly defined by WHO many years back. There are strong 8 risk factors. First risk factor is generally the older you become, the more chances of you getting heart attacks. The young heart attacks, I've just spoken to you. Otherwise, the older you become, you get more heart attacks. Being a male, you get higher chances of heart attack because the ladies are protected by a hormone by name estrogen. Although ladies can give a heart attack to a male, their chances of heart attacks are generally less. Risk factor third is smoking is one of the known risk factors. Number 4, hypertension, high blood pressure. It can cause a heart attack. High blood sugar can cause heart attack, so-called diabetes. In cholesterol, there is one special cholesterol called as HDL, the so-called good protective cholesterol. Low good cholesterol is also one of the risk factors accepted by the WHO as a risk factor. Family history of heart attacks and strokes, vascular events in the family is one of the risk factors. Sedentary lifestyle, with which I can add stress now, is another risk factor. So, if you look at it, these are all the so-called defined risk factors. Okay, now if I ask a question myself, all of us perceive 2 important diseases very common in the current society. One is heart issues, other one is cancer. Comparatively, about 30-40 years back, because we both know as youngsters, We never heard so much of these diseases are there. Heart attack was there, cancer was there, but we never heard them so much like what we hear now. So a simple logic. You please close your eyes and think what was there 40 years back, what type of life you had, what was available, what was not available. And you open your eyes and see after 40 years, what are all the newer things which you have got, and what are all the things which you are now doing, and the difference is called as lifestyle. Let me tell you honestly, both heart attack, diabetes mellitus, hypertension, and cancer, all of them are now have a significant contribution from the lifestyle. So, so what is that lifestyle which is now leading us to? Number one, lack of active physical life, sedentariness. Number two, habits. Habits were there even earlier, but extreme in habits of smoking and drinking. Number three, very important, absolutely lack of sleep. Number four, unscrupulous eating. See, when I say unscrupulous eating, even earlier people were eating more. Unscrupulous eating is eating lot of junk foods, lot of foods whose source, cooking, methodology, nothing is well known. Four. Five, very, very, very important, too much of materialistic goals and stresses. People, in fact, they don't know what they want, first of all. If they know what they want also, they don't know how to go about it. But everybody knew that, at the end of the day, they want to be running. And so that running is something which now chases people. In fact, people have a concept of this distress and eustress. Stress is defined as the body's response to a challenge. Simple definition. Distress is if that challenge is a negative challenge, you call it as distress. And if it's a positive challenge, you call it as a eustress. But many do not understand that too much of eustress is also a distress. So that is also, so somebody is achieving, the achieving gives them some standing, some value, some money. They want to achieve more. So their ambition, it's not a justifiable ambition, becomes a greedy ambition. So then, that becomes, that's one of the, again, what we see as a lifestyle change currently. So, no exercise, unscrupulous food, too much of habits, and no proper sleep. So this is a very deadly combination in the current life with so much of stress that, these things scientifically are proven to cause the so-called neoplastic changes in various cells. It causes so much of endothelial dysfunction. Finally, the root cause of heart attack is the lining of the blood vessel, which is called as endothelium. In fact, many do not know what is heart attack. See, heart attack means you have a heart which is of this size, and like brinjal, there are, like, you have seen the cap on the brinjal. So there are three blood vessels on the heart. In fact, two vessels with two branches, one vessel with two branches. So this, if you take that blood vessel, it's about 3 millimeters. So if there is a clot formation or a plaque formation which obstructs blood supply of this blood vessel, will cause a portion of the heart going for death. That's called as heart attack. So this is obstructive coronary artery disease causing a pain and resultant consequences called as heart attack. So I would say that if somebody has a vulnerable gene, with so much of risk factors, their chances of getting heart problems become high. In somebody, when all these things are not there, still they get a heart attack, we may have to suspect an inherent congenital problem inside the heart. The third one is, we have seen this more often at the time of COVID times, when because of the virus or because of suspected cause of vaccination or whichever it is, the blood clotting tendencies increased. So that was possibly like rarely, it's again a situational issue. So hope I've answered your question to that extent that it is you have to think of multifactorial, you have to think of soil, seed, and atmosphere, lifestyle things, and the classical defined risk factors. So the second part is, now how do I prevent it, or how do I avoid it? Honestly speaking, this is an evolving science. I don't think, as a cardiologist, I would say that we know the answers of everything about heart attack. Although we have a reasonable idea of treatment, prevention is still we are going. We currently say that if you don't have a family history of heart issues, a disciplined life should have certain components. You should have time for exercise, you should have time for stressing off or your hobbies and meditation or whatever it is. You should have adequate sleep. You should be very clean in your habits. Even if you have habits, you should know be in moderation. And so that means, it's an overall 360 degree of healthy life. Your chances of getting heart attacks are low. See, I can only say that your chances, because in my experience, science is never like a mathematics. In mathematics, 5 plus 5 is 10. That's also a science, but it is a logistic science. Whereas in medical science, 5 plus 5 can be 20, 5 plus 5 can be 0. Now, what I mean to say that is, if you have a very clean habit, everything is fine, your chances of getting a heart attack is low, but still you can get. But there must be some reason that we have to do. A clinician or the doctor has to do certain diagnostic methodologies and find out what is that reason. So, currently, a disciplined life, we should be give you a decent protection of life. And number two, if you are from a vulnerable family, high family history and all, you should have a lot of proactive testing. There are certain medicines are known and to prevent or reduce heart attack issues, especially antiplatelet drugs like simple aspirin, metformin. But all these things have to be advised as per the medical report or the doctor's advice. So don't self-medicate or don't self-treat without a clarity. Can definitely prevent. The third most important thing I always keep on telling, in educated society, so-called educated society, everybody know what is correct and what is wrong. In fact, it is, I won't say even it is ignorance. I would say it is stupidity in its highest form when somebody who is very well reasonably educated by a second tier degree or a third tier degree, they know very well that they are abusing their health, but they think that they are somehow they would not have that issue. It is something like, when somebody is driving uh, very high speed in a highway, you know that you have a chance of uh, accident is high. So, so nobody need to tell you that if you drive fast, even if the road is empty, your chances of high, because suddenly somebody comes, you hit. But at the same time, the slow driving fellow doesn't mean that he never has an accident. He also has an accident, but the chances are less. This is exactly what happens in heart. So please, unless otherwise We call it in cardiology as primordial prevention. The prevention is in three levels. Primary prevention is that, if you are from a family of heart problem, you should take proper precaution. That's primary. Secondary means once you have had a heart problem, at least after that you discipline your life. Tertiary means if you are had a heart problem, you are on a secondary prevention, but how well you can rehabilitate yourself and go is called as tertiary prevention. But that is something called as primordial prevention, in which in the society which is vulnerable for a heart, like our current society, a lot of things happen at the level of society. So the awareness should be, in fact, we had our World Heart Day a couple of days back. 30th of September was the World Heart Day. The WHO say that, you have to drive this. This year's slogan and theme was Action for Heart. So it's not just we keep on talking about heart, this, that, but please do something by yourself or do something at the society level. So in our country, I think nobody seems to be bothered about the health. It's one of the poorest allocations of budget in our country. We get less than 4% of allocation of health budget, whereas we have 8 and 12% allocations for defense. And we don't have time for anything except discussing about what has happened in Tirupati Laddu or what is now happening in some place. Nobody seems to be bothered about the health aspect of the society. So the primordial prevention, if it has to happen, it has to start from the top. It has to percolate down. And we have to take this as a serious message. And in fact, I happened to go to Bengaluru a couple of days back. The taxi driver, he was taking me through zones and he was telling one society, sir, this is a place where there are no married couples. They all live together here, sir. He says in one particular locality. Then he goes to another, sir, this is a place where all the technology guys, IT guys, they start coming here after 7 o'clock. They are here till 3 o'clock. Like that, he was telling me the so-called zones of Bangalore. Earlier, I used to know Bangalore had different zones, but this is a new type of zone which I realized. So what I am trying to tell, so we cannot talk more of no more Westerners here. I think we are something going different in our society. So we are growing very well, very fast, but awareness should come in. The ignorances should pave way for learning, active learning, and having learnt, like this year's theme, action for heart. You have to act. So that is a full circle of which I want the people to know.
Beautiful. Thank you very much. So if I were to look at it, to recap for my head, there is a predisposition coming from family history. There is that is nature. I can call it nature, and my lifestyle of how I'm living life, which is nurture. Both of these have a bearing on how the physiological body is. And in terms of I came across a very interesting thing that there's this book by Professor Robert Sapolsky, and he was talking about biological evolution. He's an evolutionary biologist, and a very interesting anecdote, a point that he makes in one of his lectures, and he's written in his books as well, is that genes are not predictors. It doesn't mean that if you have the gene that it will happen. The probability of it happening is there, and what turns on the switch is your lifestyle. So, a very interesting concept he made was that it is not that you will inherit, they are heritable.
Exactly.
They are heritable, and how you deal with what is heritable, which is the lifestyle, makes all the difference. So, and once I understand what my genetic predisposition is, I need to be aware, I need to be careful if there is a history. Coupled with that, I also need to look at what I need to do in my life, which is I need to ensure I'm in no order, like you said, but I need to sleep well, I need to exercise, I need to eat responsibly, I need to be focused on ensuring that I'm not running after just empty goals, material goals. I need to find time to feed my soul, if I were to say. Did I miss anything out?
Yes, no, you have completed.
So, in all of this, in terms of genetics, we can't do anything about. I've inherited, it is generations upon generations of genetic predisposition that is there. What I have in my control, I have no control over what I have done yesterday, 1 moment ago also. So I have a choice from this moment on. If I were to look at sleep, exercise, uh, nutrition, food, if these are the three that I will look at in terms of a lifestyle, I'm not going to distress and eustress doc right now. Sleep, exercise, nutrition, which will have the greatest benefit accruing to me from ensuring good cardiovascular health? Which of the three should I focus on?
See, if you ask me now, you have two eyes, which eye is important for you? So, why I say this, scientifically, they are all interconnected.
Correct.
See, if I say that food is very important, so by eating alone, can I prevent? My answer is no. If I say that exercise is important, by exercising alone, my answer is again no. So they are all interconnected. So as you beautifully said, I would say that the nature-nurture concept, the nurture consists of these important three things: adequate sleep, adequate sleep and stress-free mind or less stressed mind, disciplined food and disciplined habits, and a decent disciplined exercise. Because I want to stress this word, disciplined exercise. Again, you now keep hearing people who hyper exercise, over exercise, and they are prone for sudden cardiac events. There are so many videos which come in circulation, somebody in a gymnasium suddenly swooning down. And so what you should know, again a small basics I would like to highlight. We have a word called as sudden cardiac death. SCD we call it. SCD. A sudden cardiac death is defined as a sudden death happening in a person who was alive 1 hour back as a normal person. When somebody was normal 1 hour back, and within an hour if he has a death, we call it sudden cardiac death. 90% of the time, 90% of the time a sudden cardiac death happens due to heart. And in heart, 90% of the time a sudden cardiac death happens due to an arrhythmia. Arrhythmia is a beating disorder of the heart. In a heart attack, I told you the blood supply to the heart gets disrupted, the heart cells start dying. A dying cell becomes cranky cell. It starts showing some extra beats. These extra beats in a row can cause dysrhythmia or arrhythmia of the heart. So a decently beating heart of 70 to 80 beats suddenly starts beating 200, 300 beats, or starts beating 5 or 10 beats, and that heart disorder causes blood supply reduction to the brain, and within no time the person's heart stops. So this is sudden cardiac death. So many conditions ultimately lead to this rhythm disorder of the heart, which causes a sudden death. So this sudden death, which happens because of an acute event, many a time is not preventable once it is set in. So they predictably happen in somebody when there is an abuse of a system beyond a level. So too much of exercise can cause an arrhythmia due to certain conditions which happen in the heart because of accumulation of some chemicals. Especially very important, somebody who has been regularly exercising, keep on slowly increasing the exercising, like you are telling that you climb up so many times, these things, if you are building it up over time, regular, no problem, generally they tolerate well. Unaccustomed exercise, this very very often happens. Somebody who has never even walked fast, to catch a train, this fellow is holding two suitcases, he has never run in his life, he starts running, these fellows develop a heart attack many a times in the platforms. Somebody who has never had gone to exercise, now he doesn't know what is the spelling of exercise, he goes to a health checkup, the doctor checks him up and says that you need to start exercising. The next day he comes and starts running a marathon. He is again a highly vulnerable. So unaccustomed exercise. In somebody who is young or middle aged, suddenly you expose them, they can have issues. So that means proper, I would say that exercise also is like a medicine. It has to be prescribed, it has to be clearly defined. But the best and simple thing I always say, the safest way for anybody, for everybody, walking is a very good exercise, or jogging. Generally, I would advise that somebody should have an habit of doing it for about 20 to 30 minutes a day, brisk walking or slow jogging, about 6 times a week, or even at least 5 times a week. This gives an adequate situation where most of the time now this is adequate, I would say. Although now there are so many extremes are being, you do so much of this. See, I would say that my message is more to the common person, the public, who should have an idea. The second important thing, coming to the food, so many diets are discussed. That totally low carb, A carb diet, caveman's diet, paleo diet, intermittent fasting, so many things are being spoken. I would say very simple is, generally you should have one good meal, one moderate meal, most of the time that's sufficient for us. A decent snacking, that means in between you have to give time, there is no binge eating, no continuous eating, no overeating, and so eat in moderation. Whatever you are taking, eat in moderation, and never fill your stomach full. Always have you have about, if your stomach has 100% capacity, you eat for about 75 to 80%. Leave 10-20% simple. And so simple, because I'm trying to tell you simple. And natural foods are always better than artificial foods, complex foods. Vegetarian foods have advantages compared to non-vegetarian foods. Although there are some good non-vegetarian foods, like you can have eggs, lean meat, well-cooked lean meat. Whereas the so much of red meat and so many newer things that people talk, where this type of complex cooking, those type of things causes issues. Fruits and vegetables generally are one of the most preferred, because they can never give you any harm. Although you have to make sure that they are very well washed, cleared, because there are a lot of other chemicals people talk about. Sleep is one which is finally the most hit. Because many people at younger age, they are very confident that the sleep deprivation doesn't harm them. I would say that if somebody wants to, IT professional doesn't understand what is sleep deprivation, I tell him it's simple as a bank account. In a bank account, they understand that very well. If you deposit money, it stays. If you withdraw money, it causes a loss. So, generally, everybody has to have around 6 to 8 hours of good sleep. So, it is a deposit. I think it's a simple mathematics. So, if you have sleep deprivation, 2 hours, if you even decrease a day, I'll tell you your efficiency. And there are certain chemical processes which happens inside. These type of, especially undue sleep deprivation, increases the clotting of blood. Coagulability increases. It doesn't happen overnight. Over time and time and time and time, and so same thing happens with stress also. Stress causes, we call it as a rheological changes in blood. So the blood clotting tendency increases either by chemical methods or by certain internal changes of the chemicals. So sleep deprivation, too much of stress, all these things have some mechanisms by which the platelets get activated, the rheological thrombogenicity or the clotting tendency increases, and so they also have contribution to and so that means exercise, food, adequate sleep, and this is one which I always say that, see, in this busy world, everybody is busy from morning they get up to early morning they sleep. So morning only they get up, the morning only they sleep. Only the early morning and little late morning, that's all. And so they are so busy with giving appointments to people, they are always busy with this, that. Nobody takes their own appointment. Now I give a concept called as, please have your own appointment every day. Now what is this own appointment? I say that if you should have, if you are awake around 18 hours a day or 17 hours a day, this 17 hours you give time for your eating, you time for your dating, you time for your profession, you time for your friends, time for your family, you give time for your habits, so many things you give. Do you give time for yourself? Now what is that your time? This your time is something in which, number one, my exercise time is my time. During exercise, if you want, you can listen to something, no problem. Or you see something, because some people have a habit of doing a slow gym and, slow walking and seeing television. Doesn't matter. That is my time. I say exercise should have two components. One is exercise which should give you a faster heart rate, should be around 70% of your peak maximum heart rate. And you should give you, when you sweat out, your fat gets burnt, you get some good chemicals, endorphins produced. And there is another type of exercise called as flexibilities, which can be easily achieved by some stretches or simple yogasanas. So that about 20 minutes to half an hour. That's my time. Another half an hour, my appointment will have myself sitting quietly somewhere. Now, many people mistake this with religion. There's nothing religious in this.
Absolutely not.
This is purely, I would say that this is called as a mind calming. The simplest way somebody can do is just sit quietly. When you sit quietly and with good your spine erect, you sit just for another 10 minutes, simple, what we call it as simple pranayama, or simple. Take a deep inhalation, deep exhalation. Just so 5 minutes you do that. The next 10 minutes you start watching your breath. Many do not know that this is one of the best meditations which you can do, which Vipassana teaches it so well. So half an hour, I have told you, half an hour of stretches and exercise, 10 minutes of deep inhalation, deep exhalation, another 20 minutes or 10 minutes even of watching your breath. Please, if you can do this 1 hour, a day, your own appointment, let me tell you, you will start seeing how your life changes. So this is doable by everybody, but when you say that you have so much of appointments, this 1 hour, in my understanding, you can get only in the morning.
Correct.
You cannot get it in the mid-noon, you cannot get it in the evening, you cannot get it in the night. So that means if you have a habit of getting up at 6 o'clock in the morning, you have to get up at 5. If you have a habit of getting up at 7 o'clock in the morning, you have to getting up at 6. That 1 hour. But for the 1 hour before that, you need 10-20 minutes in which you brush your teeth and you go to your the morning regular work ritual of your motion, urine, all that. So let me tell you, this is one which can bring in a tremendous change in the society level. Your emotional control will improve, your concentration becomes better, you feel brisk the whole day, your energy levels are high, and your efficiency of working becomes better. All this is what is needed, and it is a part and parcel of heart protection system. HPS.
Heart protection system. Now, when I asked you this question about sleep, exercise, nutrition, and you asked me, can you pick one of your two eyes? I was relating it to the study that I came across somewhere, that if I don't get the right quality of sleep, if I have an apple in front of me and if I have some snacks, junk food in front of me, even though I'm aware, I will reach for the junk food. And I started going a little more deeper into this to understand, why does this happen? Apparently, the microbiome, when we have not slept enough, the rest and digest system is not taking over. The fight or flight, the distress system has taken over.
Okay.
And apparently the microbiome, they are saying the microbiota, they are saying that, we need to be ready. We need to be ready because there's something not right in this colony, and we need to be prepared with resources all the time. And therefore, a fruit which is healthy nutrition, it will take a certain amount of time for it to be processed. This already processed junk food, the microbiota says, I don't need to do so much process. I can give you the energy that you need because you are in distress mode. I started noticing it when I didn't sleep well. And I would be doing clean eating. But some days I'll feel like wanting in the morning to go and have some snacks. And I wondered what was going on. And I realized that night I have not slept well. When I don't sleep well, when I go to the gym, I find that when I start working out or when I do my walk or whatever it is, initially I'm very sluggish. After a while I get warmed up. But it is never as fulfilling, it is never as good as when I have slept well.
Okay.
So both my eating and my exercising are affected by my sleep.
Sleep.
My sleep is affected by what I eat.
Exactly.
My sleep is affected by the amount of exercise I do, when I do the exercise. If I exercise in the evening, then I find it difficult to sleep in the night.
Exactly.
If I exercise in the morning, I find it easier to sleep. So I was just listening to it and said, absolutely, they're all, it is an interconnected, it is.
Yes.
If I move something, it's like a waterbed. If I push one side,
Other
something
side.
else will go up.
Exactly.
So I need to find a way of making sure that there is a balance, an awareness that I do this balance with.
In fact, one point which I wish to share is there's a very common thing of binge eating in the night, and with full stomach, people going to sleep immediately after that eating. In fact, if you see about this is very clearly defined people who do that, their chances of developing diabetes mellitus is very high. See, if you see as a lifestyle disease, diabetes is very, very high. You can see in the society. See, our digestive system also work diurnally. See, we know diurnal variation means when the sun is there up, your system works differently. When the sun is down, the system works differently. So generally, when the sun is up, your digestion capacities are very good. So that's why people say eat well in the daytime. It gets absorbed well, it gets digested well. When the sun is away, eat less. So eat like a king in the morning and eat like a beggar in the night. Now here everybody are now kings in the night and beggars in the morning. And none of them eat breakfast. Nobody eat this thing. So this, they just brush it aside. But unfortunately, there's a science behind it. Obviously, you get hungry in the night because you don't eat well in the daytime. So that eating binge and with so much of you add some spirits at times to the binge, and with so much of complex food, the digestive system was strained. It puts a lot of that's one reason why the colonic, what we call a transit time in the digestive system takes longer, food stays longer. And so usually, ideally speaking, your dinner should be comparatively light. I won't say very light, comparatively light, and you should finish it before 8 o'clock or 7 o'clock. You should have a clean 3 hours or 2.5 hours between your dinner and sleep. Now, when we talk this, it appears like, these guys are all
not practical.
Yeah. Everything is possible.
Absolutely.
But it is under your control. You have to.
I will share what has happened in my life. I stopped eating after the sun goes down. I said no caloric intake after the sun goes down. So sometimes I came across this thing that 3 hours before sleeping, no food, 2 hours before sleeping, no liquids, 1 hour before sleeping, no screens, and as little light as possible. Started practicing that, and I used to use that 1 hour before no light. What you were saying, I just sit down and do basic breathing exercises. No religious connotation. I just count 1, 1,000, 2, 1,000, 3, 1,000, 4, 1,000, 5, 1,000, 6, 1,000. 6-second intake, hold for 6 seconds, exhale for 6 seconds, hold for 6 seconds. So this 24-second is one breathing cycle. The days I do this, I sleep better. The days I do this, when I wake up in the morning, thanks to all the gadgets that we have today, there is this software that I use which tells me what is my recovery time. It takes into account the heart rate variability, it takes into account the resting heart rate and the sleep and the exertion that I have had during the day. And it tells me that today, your recovery isn't great, so go easy on your exercising. And so coming back to this, is it practical, not practical? I think, like you rightly said, in the first part, Doctor, you said, if you are really interested in doing something, then you need to apply yourself.
Yeah.
Right? So I have started applying myself. So meeting friends, I've started telling people, let's meet for lunch. If we are meeting, let's meet for lunch.
Not dinner.
Not dinner. If it is dinner, I will come. You guys eat, I won't eat. My company is my company. It is not dependent on me eating food along with you or imbibing spirits along with you. I say I'll happily sit down with a glass of water or some fresh lime salt. I'll sit there and I'm happy to be there. I will not eat anything. I have found this exceptionally useful in my life. Yesterday, after a long time, because I traveled in here, I had dinner. I didn't sleep well. I didn't sleep well because I've got used to not eating after sunset. So I think that it is possible, and it is, again, if you look at it evolutionarily, I don't think we had so much of food available. and that we would necessarily eat with the sun. When the sun goes down, we wouldn't probably
Exactly.
eat. And we would use that time for societal interaction, community interaction,
Exactly.
which is where I think music, all of those things came from.
Exactly.
So, doctor, in terms of, I'm going to move to the elephant in the room, so to say, which is distress. You rightly said that there are too many people with too many material goals. And that depends on how their life has been and what their, like you said in your childhood, what your influences have been. Right? Societally, and this is something that I notice everywhere. On the roads, we see this, we see it. I heard it very interestingly. Somebody said three people in India cannot stand in a straight line. Two people can stand in a straight line, three people cannot stand in a straight line because everybody wants to get ahead of the other, which is a reflection of wanting to achieve more, which is, when I look at it positively, it's a useful thing. But when it becomes mindless and I don't know why I'm running after that goal, whatever goal I'm running after, if I don't know why I'm running after that goal, then it becomes a mindless pursuit. Right? In your experience of, as a doctor, can you share some anecdotes of how people, one, how you've given us an indication of how you blend all of this work-life integration, as you call it. How have you seen other people that you have taken inspiration from, who have been able to, let's say, set the right kind of objectives for the right reasons, and they say, you know what, this is meaningful, I'm going after it. This is meaningless, I'm not going after it. How do you get that integration? How do you get that clarity?
See, basically now it's as simple as it. See, when I sit in a car and drive, if I drive in a meaningful speed, I can, or get driven by meaningful speed, I can see outside and I can watch what is happening outside because my vision is clear and my contact is better. And the same, on the contrary, if I go by this very, very fast, like in a train or somewhere, when I see outside, nothing I can see. I can see only things moving fast. Now, why I say this context? Same thing happens in life. So, number one, the life here, unfortunately, I would say that especially people who live in tier 1 and tier 2 cities, life is putting a lot of stress on them because they're getting from morning, they start to go to work itself, that to 2 hours or 3 hours. They are under tremendous stress because of the commuting, because of the indisciplined traffic which is on the roads, and this is putting a lot of stress on people. So those 3 hours, if you really have to face it well, as I told you, my morning 1 hour can make you a little better, at least. Now coming back to the question, like it's, I always say in life everything is a choice. Now if I choose to be what I want, then you have to choose to do certain things which will make you achieve that. So I can take my own example. Like, when I came to practice when I was 29 to Coimbatore, that is 94, I would say. 1994 to 2004. I can clearly say 10 years. I was like a typical example I put myself in. I used to leave the house at around 8 o'clock in the morning and 8:15, and I used to come back home around 9 o'clock in the night. Lunch is usually at the workplace. Either I lunch come home. But so I used to be extremely busy and doing procedures, clinical cardiology, teaching, and visiting various hospitals in the evenings, and come back home with bags full. In fact, I remember my son who was very young, he used to, if he is awake at around 9 o'clock, when sometimes I come back home, he will first look into my pockets and see how much of money I have in the pocket. So he would tell proudly to his mother that, see, Appa has worked very hard today, he has got a lot of money. So because we earlier we used to have a system in which, I visit and see a patient, they'll give money directly. So that you used to, I'm talking about 30 years back, the practices. Now, no UPI, no Google Pay, or no nothing. Either it's cash or check. That's how it used to go. So, but one thing I was very clear, even then, I had a disciplined life in which morning I used to have a half an hour to 45 minutes for my own. I used to engage in picking flowers, doing some sort of newspaper reading, regular games. I used to play shuttle for about half an hour. So I had a discipline. And once I have a good breakfast, I eat a little late lunch, come back home, and generally, even if I eat at 9 o'clock, I will sleep only around 11:30. Morning again, I start around 6 o'clock. This is, so I used to get night calls, I used to get disturbances, but 10 years I was very active like that. Then the year 2004, I took a decision to stop my evening practice. I somehow felt that this evening practice was putting too much of pressure on me. So I choose to stop my practice. Yes, there was definitely, it would put a small dent in your earnings, but I did not mind because I felt at that time myself, my family, and time with the family becomes more important. So I felt that I should do. From 2004, I started disciplining my working hours. I would be available, and by the time I became slightly a senior, I had some juniors to take calls so that I will get second call and third calls, etc. Then comes a period in 2013. That's another exactly 10 years from 2004. I had this type of working from morning 9 o'clock to evening 5 or 6. I still had 3 hours left for me in the evenings for myself. And I was balancing the uh, working life as well as my family life well, and that's the time I started spending more time in my other habits of my singing, my socializing, and things of that kind. 2014, when I went abroad, and I became there an administrator in hospital. In 2014, I became a medical director of Ahalia Group of Hospitals in Abu Dhabi. There, from 2014, I reduced my work time to still further. I used to work intensely about 6 to 7 hours. Morning I had 2 hours extra. I used to start early. I used to get up at 5 o'clock. I always had time till about 9. And night I sleep early, but evening from after 5 I was free. That I am continuing even now. So even now, after I came back to India, I took the same type of administrative work. I don't take active clinical work. I don't generally get night calls as a cardiologist, but I have adequate time for my work because now I enjoy my work. Doing from morning 9 o'clock, 9:30, I start my morning work. I go till 5 intensely. I go. I enjoy the work. I don't eat lunch. I have a good breakfast. I just have some snacking of something and drink some thing. Mostly it's either a tea or coffee, one. And I go home and eat my dinner earlier around 6 o'clock, 6:30, not 6 o'clock, 7 o'clock, 6:37. And I get adequate time to exercise. I get adequate time to read. I get, I enjoy socializing, but now I cut down my evening socializing unless it was extremely important. And if I'm invited with my wife, evening is for our time. I don't leave her and go. I avoid going alone for evening parties or this, that, and generally I avoid going there. Now, I choose all this.
Correct.
I chose, and Probably, I think that where I say that. So I think nobody. It's like one of the old English proverbs. You can take a horse to a pond. You can't make it drink. See, unless otherwise, that person, whomever wants to discipline themselves, should discipline themselves. See, we are not in an age where somebody can discipline you with a cane or by a gun. You have to discipline yourself. So what do I get out of discipline? Once you discipline your life, basically, honestly, hear it from me, everything is disciplined. Whatever happens, discipline. You discipline your thinking. All of us get bad thoughts, but you can discipline it. You just brush it aside. Okay, I don't like it. I don't want it. So you get discipline in eating, you get discipline in walking, you get discipline in everything. So if you want to have a disciplined, balanced, healthy, good life, you have to all these things. But if you think that, again, I always say that as a doctor, I hear it very often. I give a medicine to a patient, and patient says, "Doctor, I take it for yourself." I said, "Don't take it for myself. Why you should take medicine for myself? Why should you eat for myself? Why should you exercise for myself? Absolutely nothing. It is for yourself. I am like a traffic constable. I can only say that just go slow. If you go fast, you will have an accident. Just be in yellow means this thing. So you take a U-turn here, go that way. This is what we do. We are all like traffic constables, any doctor. So you are driving your vehicle, so you should know that if you eat the medicine, if you do exercise, if you eat well, everything is fine. So why I say this is, unless otherwise it comes in that person's mind, then it's a change. The change starts from within. Then automatically everything.
This is an area that one of the things that I tell people is, I recently had a client call me. Incidentally, person is in Coimbatore, and calls me and says, "Chinu, this is what's been going on. My blood sugar levels are high. I'm doing this. I'm not exercising. I'm not this. I'm not that. I know all the things that I should do. I'm doing all the things that I should not be doing, and I've observed this about me, that I am doing things that are not useful for my mental or physical health, and I'm doing things that are not good for my physical or mental health.
Yes.
I want to understand why I'm like this." So I said, "You know what you're supposed to be doing?" "Yes." "You know that what you're doing is not useful for you?" "Yes." So there are two questions I'll ask you. If you continue doing all of this, what do you think will happen? The person said, "I will die." "No, you'll be lucky if you die. You might end up being a vegetable. You might end up being a bother. You will not be able to take care of yourself." I think that's the worst torture in life that a human being can go through. That for everything, I was born capable. I'm not for any reason saying that there are people who need somebody else to take care of them. I'm not talking about them. I'm talking about people like us who are capable of taking care of ourselves. The worst thing that we can do to ourselves and to society is to become a burden on society.
Yes.
So I told him this, and I said, "If you're lucky, you'll die." I didn't use the word sudden cardiac death. But I said, "If you're lucky, you'll go off like a bulb going off. Tuck. Switch goes off, you'll die. Then everybody around you will be unhappy. They will cry. Life will go on." That's the best thing that can happen. The worst thing that can happen is that you will live, you'll be in pain, and you can't do a damn thing about it. And you will be a pain for everybody. So I did an exercise in psychology which is called the DILS exercise, which is, what is the present behavior? Close your eyes, think about it. You're continuing to do it 1 year from today, 5 years from today, see what's going on in your life. 10 years from today, what's going on in your life? 20 years from today, what's going on in your life? Then bring them back. And I say, how was this journey? Horrible. I said, okay. Now, tell me, what would you like to do instead of this? You know that you should not be eating all of this. So consider eating what you should be eating. You know that you should exercise. So consider exercising. You know that you should be sleeping well. Consider exercising. And now close your eyes and let us now go on an imaginary journey where you are eating well, properly, with discipline. You are sleeping well, with discipline. You're exercising well, with discipline. 10 years, 3 years, 5 years, 10 years, 20 years. And then when we do that, which journey was better? The person said the second one. I said, lovely. Now I want to ask you one more interesting question. You know that your current behavior is going down the hill, which means I only have to tell you that you want it to be that way. So let me ask you this question. Why would you want the second journey? What is the reason you might want to have the second journey? Is there somebody aside of you that you want to live your life for? He said, you know the answer. I said, yes, I know the answer. You have 2 young daughters. Should you not live healthy and be well, at least to take care of your daughters?
Yes.
He said, yes. I said, so come up with an objective where you are not doing it for yourself. Because you have 2 young daughters who did not ask to be born, you have a duty to them to make sure that you are around, healthy, and around to give them the life. After they become adults, then they are on their own. So I think somewhere the statement that you made, Doc, which is, I choose, I choose, I choose. I have a choice in every moment.
Yes.
My coach, when I met him 20 plus years ago, I said, Kichu, I can't, I have to. He said, no, Chino, you can choose to. You don't have to do anything. The only thing that you have to do and you will do is die. In everything else, you have a choice. So I think this choice, you made this very interesting choice, which is enough.
Yes.
You said enough. You could have kept on going.
Yes.
And you could have made a lot more in terms of money, in terms of professional accomplishments, and a whole lot of things.
Yes. Yes.
But you said enough.
Yes.
I'm reminded of another anecdote. Kurt Vonnegut, the person I think who wrote, a book. He was at a billionaire's home in a party. And his friend who had taken him there was saying, this is the amount of money this man makes, this is the amount of money this man makes. And this man finally looked at him and said, all that is fine, but I have something that he'll never have. So the person said, what is that? And the person said, enough. I have enough. So I think it's very, very important for us to understand that enough.
Yes.
Not compare ourselves with somebody else.
Yes.
I need to eat based on what I'm feeling hungry, and I need to look at what's on my plate, not look at what's on another person's plate. So I'm taking, it is stating the obvious, like you said. The anecdote that you shared when we were having breakfast. 82-year-old person asking you, doctor, what should I do? How should I live?
Exactly.
And your answer, I think that was amazing. You have lived for 82 years. I am much younger. You have to tell me how I can live to that age.
Yes, exactly. That's it's not just a humor, but that is a fact. As I tell you that when you are talking this, what was going in my mind also is, finally, as you say that again, you should have a mindset of defining. Okay, that's enough for me, and you should have a mindset of deciding that I choose to be like this. I think it's all finally comes. There is a lot of things which have to go within for you to do out.
Beautiful. I think that's a lovely place to take a break here, and we'll wrap up this section. This section we've dealt with physical, mental, emotional health, what makes for a good physiological, mental, emotional life, and spiritual grounding is extremely important for that. Spiritual does not mean religious. I loved what doctor said in this section. Make an appointment with yourself. That appointment that you make with yourself should be the first thing that you do every day, and without which you will do nothing else in your life. And you can decide how long that appointment is going to be. You could start with as short a time as 20 minutes in the morning. This is me time. And slowly make it 30, 40, 50, and then make it maybe two sections of 1 hour in the morning and 1 hour in the evening for you. And if you can do that, I think life will be a lot better. You'll be happier, and I think you'll be an asset to society, not a liability to society. With that, we're going to take a break here. And in part 3, we will traverse Doc's journey as an administrator, from being a cardiologist doctor to being an administrator. What are the changes that he needed to make in life? Because many of us, we have to be prepared for stage changes in life. And that's what we're going to be talking about in part 3. Just be waiting and make sure that you listen to the third part as well. Take care.